CNA Test Skills. Question 1. Which of the following should you observe and record when admitting a patient? Color of the stool and amount of urine voided. How much the patient has eaten and drunk. Bruises, marks, rashes, or broken skin. Requests the patient makes. Failure to notice bruises or marks on the skin on admission may later cause someone to believe you were involved in abuse. Documenting any existing skin issues is a critical part of admission that protects both the patient and the staff. Question 2. Which of the following is the correct procedure for serving a meal to a patient who must be fed? Serve the tray along with all the other trays, and then come back to feed the patient. Bring the tray to the patient last. Feed after you have served all the other patients. Bring the tray into the room when you are ready to feed the patient. Have the kitchen hold the tray for 1 hour. You should not bring the tray into the room until you have time to feed the patient. This prevents food from getting cold and maintains food safety while ensuring the patient's dignity is preserved. Question 3. A newly admitted patient has dirty fingernails. When giving the patient a bath, you should first soak the nails, trim the nails, apply extra lotion, clean the nails with a metal file. Soaking the nails first will make cleaning them easier and more effective. CNAs should never trim nails unless specifically instructed by a nurse, as patients with diabetes or circulation problems are at risk for injury. Question 4. The most serious problem that wrinkles in the bedclothes can cause is restlessness, sleeplessness, decubitus ulcers, pressure injuries, bleeding and shock. Wrinkles and folds in linens create pressure points and friction that reduce circulation to the skin, leading to pressure injuries. Keeping linen smooth and wrinkle-free is essential for skin integrity. Question 5. What strategies can a CNA use to dress a patient with one-sided weakness effectively? Dress the weak side first, then the strong side. Dress the strong side first, then the weak side. Lay the patient flat and dress both sides at once. Have the patient dress themselves completely without assistance. When dressing a patient with one-sided weakness, always dress the weaker side first. This allows the patient to use their stronger side to assist with the process, promoting independence and dignity while being practical. Question 6. What are the signs that a patient may be having difficulty swallowing during feeding? Coughing, choking, or wet-sounding voice after swallowing. Rapid eating without pausing. Requesting additional water with each bite. Eating only the dessert and ignoring the main course. Coughing, choking, gurgling, or a wet-sounding voice after swallowing are signs of dysphagia and potential aspiration. These require immediate reporting to the nurse and may indicate the need for a swallowing evaluation or modified diet. Question 7. When feeding a resident, the CNA should position the resident at what angle? Flat on their back. At a 30-degree angle. At a 60 to 90-degree angle, upright or near upright. On their side. Residents should be positioned upright at a 60 to 90-degree angle during feeding to prevent choking and aspiration. Proper positioning is essential for safe swallowing. Question 8. When assisting a client with the use of a bedpan, the CNA should first put on gloves and lower the bed railing. Raise the head of the bed to a comfortable position. Warm the bedpan under warm water. Ask the client if they need to void. Warming the bedpan under warm water before use provides comfort to the patient. A cold bedpan can cause discomfort and muscle tensing, making elimination difficult. Always check the temperature before use. Question 9. A patient drank 6 ounces of juice, 4 ounces of milk, and 3 ounces of water. What is the total intake in milliliters? 130 milliliters, 195 milliliters, 260 milliliters, 390 milliliters. 1 ounce equals 30 milliliters, ml. Total ounces equals 6 plus 4 plus 3 is equal to 13 ounce. 13 times 30 is equal to 390 milliliters. Accurate intake and output measurement is critical for monitoring fluid balance. Question 10. When providing mouth care for an unconscious patient, the CNA should position the patient supine, flat on their back, on their side with the head lowered, on their side with the head turned to the side or slightly lowered, in a high Fowler's position. Positioning an unconscious patient on their side with the head turned or slightly lowered allows fluids to drain out of the mouth by gravity, preventing aspiration. Never place an unconscious patient flat on their back for oral care. Question 11. When arranging a patient's room, you should do all of the following except: check signal cords, fix the back and knee rests as directed, administer medications, check lighting. Nursing assistants are never allowed to administer medications. This is outside the scope of practice for a CNA and must be performed by a licensed nurse. CNAs may remind patients or assist with opening medication containers, but they cannot give or prepare medications. Question 12. When responding to a patient on the intercom, you should ask for the patient's name. Say, "May I help you?" Give your name and position. Say, "The nurse will answer your call." When responding to a patient on the intercom, you should give your name and position. This identifies who is responding and provides reassurance to the patient. Professional identification promotes trust and accountability. Question 13. Which of the following things should you do to familiarize a new patient with his or her surroundings? Show the patient where the call bell is and how to work it. Tell the patient not to operate the TV. Ask visitors to leave the room while you finish admitting the patient. Raise the side rails of the bed and raise the bed to the high position. You should never leave a new admit until the patient knows how to call for help. Showing the patient the call light and ensuring they can use it is essential for safety. Falls and injuries are more common when patients cannot summon assistance. Question 14. When assisting a patient in and out of bed, you should always employ body mechanic techniques. Get another person to help. Pull the patient's feet out first, and then lift the back up. Put shoes on the patient because the patient may slip. You should always use good body mechanics when moving patients. This includes keeping your back straight, bending at the knees, and using your leg muscles rather than your back. Good body mechanics protects both you and the patient from injury. Question 15. When measuring a resident's blood pressure, the cuff should be placed on the forearm, near the wrist. On the upper arm, about 1 inch above the elbow crease. On the upper arm, directly over the elbow. Anywhere on the arm that's comfortable. The blood pressure cuff should be placed on the upper arm with the lower edge about 1 inch above the elbow crease, antecubital space. This ensures the artery is correctly positioned for accurate reading. Question 16. A CNA notices that a resident's urine is dark amber and has a strong odor. This may indicate the resident is well hydrated. The resident may be dehydrated. This is normal for all residents. The resident has been drinking too much water. Dark amber urine with a strong odor is a classic sign of dehydration. Adequately hydrated urine should be pale yellow to clear. Report this observation to the nurse and encourage fluid intake if permitted. Question 17. When using a gait belt for a transfer, the CNA should apply it under the resident's clothing, directly on skin. Apply it over clothing, snug but not too tight. Apply it loosely around the waist to allow freedom of movement. Apply it around the resident's chest. A gait belt is applied over clothing, snugly enough to prevent slipping but not so tight that it causes discomfort or restricts breathing. Never apply directly to skin. 2 fingers should fit between the belt and the resident. Question 18. What is the correct bed position for a patient in semi-Fowler's position? Head of bed elevated 15 to 30 degrees. Head of bed elevated 30 to 45 degrees. Head of bed elevated 45 to 60 degrees. Head of bed elevated 90 degrees. Semi-Fowler's position is defined as the head of bed elevated 30 to 45 degrees. This position promotes lung expansion, reduces the risk of aspiration, and is comfortable for many patients who require oxygen therapy or respiratory support. Question 19. The CNA is counting a patient's respirations. To do this accurately, the CNA should tell the patient to breathe normally while counting. Count respirations immediately after taking the patient's temperature. Keep their hand on the patient's wrist as if still taking a pulse while watching the chest rise and fall. Have the patient sit up straight and breathe deeply in and out. Keeping the hand on the patient's wrist makes them think you are still taking the pulse, which helps prevent them from consciously altering their breathing pattern. This provides a more accurate respiratory rate. Question 20. Which of the following represents a normal adult oral temperature reading? 96.8 degrees Fahrenheit 36 degrees Celsius. 97.6 degrees Fahrenheit 36.4 degrees Celsius. 99.6 degrees Fahrenheit 37.6 degrees Celsius. 100.4 degrees Fahrenheit 38 degrees Celsius. Normal adult oral temperature ranges from 97 degrees Fahrenheit to 99 degrees Fahrenheit, 36.1 to 37.2 degrees Celsius. 97.6 degrees Fahrenheit 36.4 degrees Celsius falls within the normal range. Readings above 100.4 degrees Fahrenheit 38 degrees Celsius generally indicate a fever requiring notification of the nurse.